And welcome to the COVID-19 pandemic update. I am Kayode Okikelu. First, the highlights. Bauchi State commences administration of second jab of AstraZeneca vaccine in spite of some hesitancy as it hopes to get ahead of a possible third wave. Yobe State government is training healthcare givers in intensive care unit techniques to make up for shortfall of emergency response personnel. And the fear of the Indian variant is real. In the United Kingdom, authorities are calling for caution among residents as lockdown measures ease. The Nigeria Center for Disease Control has again put out guidelines on home-based care for COVID-19 patients with mild symptoms. The public health agency says it should be done on the advice of trained and designated health workers, as it asks both patients and caregivers to adhere strictly to the home-based isolation criteria and other infection prevention and control measures. In the meantime, let's bring you the latest COVID-19 trends for you today. Nigeria has recorded another fatality from the virus, a constant reminder of just how dangerous COVID-19 can be.
COVID-19 pandemic is not over in Nigeria, and the Nigeria Center for Disease Control, NCDC, is advising Nigerians to report any symptoms of the virus and get tested at any of the numerous sample collection centers across the country. Recently, Nigeria has seen a decline in the number of casualties. However, the latest update coming from the NCDC includes one death from COVID-19 complications in the last 24 hours, putting the fatality toll at 2,067. According to the agency, 69 new infections were reported from 3 states and the FCT. Ondo State leads with 35 cases, followed by Lagos with 30. 3 cases were reported from Rivers State, while the Federal Capital Territory recorded 1. Clarifying the figure, the agency says that the latest update contains data from April 27 to May 18th from Ondo State, while Lagos has a backlog of cases from the last 2 days. The new tally raises the overall count of confirmed cases in the country to 165,778. 2 people have been discharged in the last 24 hours, bringing the total number of discharged persons to 156,415. With plans for the commencement of the second phase of vaccination across states in the country, the National Primary Healthcare Development Agency is advising those who have received the first dose of the vaccine to check their vaccination cards for the date scheduled to take the second dose to gain full protection against the virus. Meanwhile, over 1.8 million eligible Nigerians have received the first dose of the COVID-19 vaccine, with more than 50% of the target population vaccinated in Lagos, Kwara, Zamfara, Gombe, Ekiti, Cross River, and the FCT. The health authorities say the target is to vaccinate at least 70% of the eligible population over a 2-year period in order to be able to achieve herd immunity. Globally, more than 163 million cases and over 3.3 million deaths have been reported across several countries.
Health authorities in Bauchi State are worried about vaccine hesitancy in some parts as the state begins administering the second dose of the AstraZeneca vaccine. Governor Bala Mohammed is encouraging traditional and religious leaders to lead by example and present themselves for the vaccine so their members can do the same. Our correspondent Hajara Ali reports.
Bauchi State has begun administering a second dose of the Oxford AstraZeneca vaccine, and the state governor, his wife, and the deputy governor are first in line to get another shot at the official rollout.
Congratulations, Your Excellency.
The rollout of the first dose was spread across all 20 local government areas of the state. Bauchi local government area presents the highest number of persons who have received the vaccine, with 11,161 persons vaccinated, followed by Ganjua with 4,887 and Turu 3,688.
As of today, we have enough vaccines to vaccinate the second dose of those people who received the first dose of the vaccine.
Vaccine hesitancy has been identified as a major challenge for the state, with Katagum local government area ranking low in vaccine recipients.
They are still thinking that the vaccine can cause maybe infertility and other reasons. And some people thinking that we are going to die, so we did not die. And Your Excellency is still working on his foot, please. You should please accept the vaccination.
I would just like to appeal to our people, to the population in Bauchi State, not to be complacent in the sense that to think that COVID-19 has passed. No.
Partners have commended the political and financial commitment shown by the state governor so far, but are asking for more involved participation.
We recommend a reboot strategy to reinforce confidence in the COVID-19 vaccines.
Governor Muhammad is impressed by overall statistics of the first dose, having achieved 98.8% coverage, and insists that all stakeholders must be fully committed.
At this juncture, I want to call on my Christian brothers. I have been surprised, not pleasantly, that most of them refuse to present themselves, especially the members, because of this campaign of calumny on population and demographics. They said they would not do it. Please, we are not expecting this from them because they are the most enlightened among our population, and if they are not presenting themselves, the followers will not really present themselves.
The question now is how soon more vaccines will be procured to cover the entire population of about 7 million people in the state. Hajara Aliyu for COVID-19 update.
Well, in not so far away Katsina State, all is set for the commencement of the second dose vaccination exercise. Earlier this month, the state government received a total of 4,150 additional doses of the Oxford AstraZeneca vaccine for all frontline workers, from medical and media practitioners to security personnel and strategic leaders. The state has so far reached over 90% coverage of the target of 1% of the population.
On March the 10th, 2021, Katsina State received a total of 107,540 doses of Oxford AstraZeneca COVID-19 vaccine meant for vaccinating all frontline workers, particularly medical and media practitioners, as well as security personnel, including the strategic leaders in the state. Barely 69 days after the commencement of the first dose, over 80% of the total target has been covered.
Now we are over 80% in terms of coverage of the total target of 1% for the frontline health workers. So we have done that. I think we are on the right track, and very soon, this week, we are expected to start the second dose.
According to the Executive Secretary of the Katsina Primary Healthcare Development Agency, special attention has been given to all entry and exit points of the state to adequately check people coming from border towns to Daura, Jibia, and Mayadua General Hospitals in Katsina State. Governor Aminu Masari of Katsina State was the first person to be vaccinated, along with his deputy, Mena Yakubu, and members of the State Executive Council, as well as the emirs of Katsina and Daura, who were also vaccinated in their respective palaces. Meanwhile, a cross-section of frontline workers, mostly medical and media professionals in Katsina, who have received the first dose of the vaccine, react to concerns about the effects of the vaccine.
I felt some mild weakness, which after use of paracetamol, just 1 gram, that's 2 tablets, and everything was okay.
I was vaccinated and I didn't feel anything. There's nothing like even the side effect that some people do complain. I didn't feel anything.
Katsina State has so far recorded a total of 2,097 confirmed cases of COVID-19 and 34 deaths. 2,049 patients have been discharged, and currently there is none on admission.
Well, for more on Katsina State's response, we are joined by Dr. Kabiru, the Permanent Secretary, Ministry of Health in the state. Dr. Kabir Mustafa joins us from the state capital. Pleasure to have you on the program, Doctor. Now, I know that the second phase is meant to begin this week, as was reported in that clip we just saw. But when exactly this week will the state begin to give the second jabs?
Yeah, thank you for picking up with me. The second dose of the COVID-19 vaccine has been given today. His Excellency, the Governor, the Deputy Governor, and members of the Executive Council, and a lot of those that had the first dose given on the 11th of March 2015 had presented themselves today for the second dose. I personally had taken my second dose, and we are doing well.
So clearly, others can now come and get their second jabs. But I know challenges vary from state to state. I mean, in Bauchi State, the governor is concerned about certain religious groups fueling vaccine hesitancy. For you in Katsina State, what's your biggest challenge in this vaccination drive?
For now, I would say the bigger challenge we'll be having is the availability of the vaccines. So far, we have utilized almost 50% of what we have. And to also be candid with you, a lot of people are yearning now to get the vaccination done on them.
Well, there are reports of people being forced to take the vaccines in your state, like corps members being told that they will not be cleared if they aren't vaccinated. I know there's a drive, clearly, to get more people vaccinated and all, but what's the government's position on that? Is vaccination compulsory for some groups in the state?
I don't know about that compulsion. What I know, vaccination is voluntary. And the government has done a lot of awareness creation and demand creation as regards the vaccine. As you are aware, all the emirs and the malams, that is the ulamas, that is the religious leaders, have given themselves to the vaccine. So I don't see anyone being coerced into taking this vaccination in the state.
Okay, so you're saying that report about corps members being forced to, would you be looking into that? There are reports also about teachers being mandated to take the vaccines. Is that something you'd be actively looking into? Because there were those claims across social media. In fact, people put out statements saying they were forced. A certain pregnant corps member was also forced to take the vaccine. Is that something you would also be looking into?
Well, we'd look at it, but this is one of the problems of I would say, the media these days. You find that a lot of things can be posted, and they may not necessarily be true.
Well, we'll take your word for it, and we'll expect at least updates on that to be sure that there's nothing untoward happening in that area. But I'd like to thank you so much, Dr. Kabir Mustafa, the Permanent Secretary, Ministry of Health in Katsina State. Thank you for your time on the program.
Thank you very much, too. Thank you.
Well, let's now take you across some other states for an update on their COVID-19 situation. We begin with Ekiti State, where the Ministry of Health and Human Services claims it has successfully attained 100% coverage of the target set at the beginning of phase 1 of the vaccination exercise. According to the Commissioner for Health, Dr. Ibanji Filani, since the flag-off of the first phase of the vaccination on March the 10th, about 48,170 eligible persons have been vaccinated. Well, Lagos is another success story, as the Commissioner for Health, Professor Akin Bayomi, during a press conference earlier in the week, told journalists that over 257,000 people have been vaccinated in the first phase. And over to Enugu State, where over 31,000 have successfully received their first jab of the COVID-19 vaccine. The Commissioner for Health, Dr. Ikechukwu Obi, however, identifies vaccine hesitancy as what has seriously slowed down the process in the state. And reports from the MPHCDA indicates that 1.8 million Nigerians have received the first dose of the Oxford AstraZeneca COVID-19 vaccine across the 36 states of the Federation and the FCT. We'll go on a break now, and when we return, the fear of the Indian COVID-19 variant is very real, especially in the United Kingdom. We'll be speaking with a general practitioner there to give us an update. To join us again. You're welcome back. British Prime Minister Boris Johnson says there is currently no conclusive evidence to cause a delay to plans to remove coronavirus restrictions in England next month. This follows reports that British ministers are considering contingency plans for local lockdowns or a delay to reopening after June the 21st in response to concern about the spread of a coronavirus variant which was first detected in India.
Well, we're looking at the epidemiology the whole time as it comes in, and at the moment, I think partly because we've built up such a wall of defences with the vaccination programme, I don't see anything conclusive at the moment to say that we need to deviate from the roadmap. But we've got to be cautious, and we're keeping everything under very close observation. We'll know a lot more in a few days' time. I think it's very important for people to understand that if you go to an amber list country, if you absolutely have to go for some pressing reason, not a holiday, if you have to go, then bear in mind you're going to have to pay for testing, you're going to have to do a passenger locator form, all that kind of thing, but you're also going to have to self-isolate for 10 days at home, not going out, and if you fail to obey that, then you will face fines of up to £10,000. So people need to understand that an amber list country is definitely not a green list country.
So let's analyze some of these emerging trends in the global fight against COVID-19, especially in the United Kingdom. We're joined by Dr. Joseph Omofuma, a general practitioner who joins us from Manchester. Thank you for joining us, Doctor. Well, England already has a roadmap out of COVID-19 lockdown, but there's a potential spoiler, which is the Indian variant. Why is this a big concern, even though vaccination seems to be in top gear?
Yeah, hi, Kayode. Thanks for having me. Yeah, I think the main issue really is the fact that, first of all, it's spreading amongst a population of people where you have low uptake of the COVID vaccine itself. So that's the first thing. The second thing is the fact that the Indian variant seems to be more infectious, more lethal, and it's affecting young people. So all this contributing seems to be a possible clog in the wheel of the progress that we've made so far.
What particular population do you have challenges with vaccine uptake, especially in that area, that might make this a very difficult fight for the UK?
Well, basically, it's well known that it's in the Black and ethnic minority. So you're looking at the Afro-Caribbeans, the Asians, and in this particular occasion, it's where you have a large congregation of Asians, Indian and Pakistani brothers. That's where the Indian variant is spreading. So that's the main cause of concern. As you're probably aware, in the UK, the Black and ethnic minority that have also had the most severe symptoms of COVID and the most mortality. So it's a bit of a double whammy, if you like, when you consider it.
Well, now that you speak of that, I see you co-developed a safety assessment system, which is essentially a result of, like you mentioned, disproportional deaths in the minority ethnic groups, especially Africans, which will be our focus. I mean, an average 40-year-old black man with 2 medical conditions is nearing high risk in the UK, according to that particular risk assessment, which you co-developed. So how relevant is that in getting a handle on COVID-19 in the United Kingdom and even here in Nigeria?
Sorry, I didn't quite get that. What was the question?
Well, I was referring to that safety assessment system which you co-developed, which tends to at least help you get a sense of just how much of a risk you are in if you have COVID-19, if you belong to a certain ethnic group at a certain age with certain medical conditions. And I'm just wondering, how important is that really in getting a handle on COVID-19 there, where you have those ethnic minorities, and here in Africa, where those ethnic minorities are actually majority?
So that's a very good question, Kade. The point is that within the UK, that risk assessment has more or less saved a lot of lives. It's in honor of one of our colleagues, called Sad, who unfortunately died from COVID. I knew him quite well. He was one of my trainers. He unfortunately died from this assessment or algorithm. myself, my colleagues got together and we got this together. Now, it's so far it's been adopted across the board, across many hospitals and trusts here in the UK. Now, when it comes to the Nigerian scene, that's a totally different scenario entirely because, as you probably are well aware, the amount of people getting COVID in Nigeria is nowhere near what we're seeing here in the UK, even though you have a very large Black population. And there's a number of reasons for this. One of which is the fact that, well, the weather is very different, and so the transmission is going to be less. Also, as you know, in Nigeria, we have a lot of immunity to a lot of illnesses anyway. In addition to that, one of the main things that have been found to be very protective for COVID-19 is vitamin D, which we get from the sun, and we have an abundance of the sun in Nigeria, coupled with the fact that not a lot of Nigerians travel outside of the UK compared to the overall population. So when you combine all these factors, has been helping us really.
Well, Dr.
Hello, did you
Omofama,
get that?
not quite. It's been quite a struggle getting your response to that question. We lost you at the latter part where you were trying to just round off on that point. But I'm hoping we have you back. So let me sneak this question in, hoping that the connection will work. Well, Nigeria is also keeping an eye on that Indian variant, which is a big challenge across the world. Over 20 countries have reported that variant. Now, the government here in Nigeria recently restricted travel from India, as well as some other testing and quarantine rules. So, I mean, you know what's happening in the UK. I've given you a snapshot of the government's response right here. Do you think that's enough to keep the Indian variant at bay?
Well, the simple answer is no. I don't think it's anywhere near enough. I don't think we're doing enough in Nigeria, unfortunately. I don't want to sound like I'm slagging off Nigeria, but we could do a lot better. I mean, we could do a lot better. There's so many aspects of the vaccine. For example, the vaccination program just hasn't taken off well enough. We have almost 200 million people in Nigeria, and only 1.8 million have been vaccinated. That's less than 1%. So I don't think that's nearly enough. I think whatever the government needs to do, whatever agencies are involved, rather, they need to toughen up those things, because God forbid that the Indian variant should come to Nigeria. It will be a big problem, and we pray that that doesn't happen.
But, Doctor, what more can you do? Getting vaccinated is not compulsory, and I don't think it should be compulsory. So really, what more can governments do, leaders do to boost this vaccination drive?
Well, I think in terms of government, well, if you split this up to be there, government needs to do a lot more. They need to spend more money and get more vaccines into the country, period. Also, the most vulnerable people, what we call risk stratification or triage, there needs to be some sort of a triage system where the most vulnerable, the elderly, the people who have chronic illnesses, this is what has been done successfully in many developed countries, including the UK. They need to be prioritized and be given this vaccine first. It shouldn't be a case of whoever has the money or whoever lives in a big city should be getting this vaccine. So those are the kind of things that we're talking about that needs to be done. And if you talk to my colleagues in public health, they will tell you these are things that are known, but we need the government to listen. In terms of the population, we need to get people to still keep trying to maintain social distance, to wear masks when they're in public places, and to continue.
Well, we did push the connection, and I'm glad it worked out. But Dr. Joseph Omofama, general practitioner from the UK, thank you so much for your thoughts. Let's do this again. Well, that's the program for today. But just before we go, don't forget to protect yourself. COVID-19 is still very much out there. So continue to take responsibility. And of course, visit our website, channelstv.com, for more updates and better understanding of the pandemic. We also have all the big stories from politics to business and sports, all at your fingertips. Well, thank you for watching the program today. I'm Kayode Kikiolu. Do stay safe.